We're really excited to have this discussion this year. My name is Yehuda Charm. I'm a senior project manager at Foothold Technology. I'm joined by some wonderful guests, and they'll get a chance to introduce themselves in a moment. So when we were thinking about this session today, I personally got very excited to be involved in this. I'm a social worker. I went through grad school for social work. I worked at a not-for-profit for about 7 years where I provided direct care service to clients. I ran a little program. And then over time, we started to think about data and wanting to collect that in a more meaningful way. And I helped implement a system at the agency, and my role shifted from running this program to actually managing the database. So when we talk about data, which is what we're going to talk about today, it's something that's particularly exciting and meaningful to me. So I was very excited to be part of this. Once I wrapped up that implementation at the agency, sort of a natural fit to come over to Foothold, where I could work with lots of agencies as they implement software full time. So I'm going to turn it over to my panelists here in just a moment. I just want to talk about our format a little bit. So it's going to be slightly different. What I'm going to do is I'm going to moderate by posing questions to our different panelists, right? So I'm joined by Laura from Foothold, Jim from Catholic Charities, and Nancy from, Catholic Charities Brooklyn, Queens, and Nancy from Nancy Dodd Research, and I'll talk in just a moment. So I'll pose questions to them that'll all talk about data and using your data in a meaningful way to tell a story. I feel extremely privileged and lucky to have worked with my colleague Laura Marshall on this. I think for those of you who know her, she's endless source of inspiration and logical thinking, and really a great person to work with. So it was something I enjoyed a lot. So,
Thank you. Thanks, Yehuda. Sentiments reciprocated, for sure. So each of us are going to introduce ourselves a little bit here, give you a little bit of background, and then we'll jump into the panel. So I know some of you in the room. I've been at Foothold a long time now, almost 10 years, or actually more than 10 years. But before that, I spent about 5 years living and working in rural, small town Africa. First, I was a Peace Corps volunteer, and then I directed a nonprofit with a mission of helping young adults secure or generate employment. And I want to talk about that experience for a minute, because I think there's a corresponding challenge to, in that environment, and the one in which all of you work directly, that speaks directly to the notion of storytelling and the importance of context. And we're really talking a lot today about the relationship of narrative and data, and how those two things really need to come together in order to be able to really communicate a message of value that people are going to listen to. So sort of speaking hypothetically, but based on experience, that young adults or youth in rural Africa, and I'm not talking village here, I was in towns and like regional areas, so there was infrastructure, there was commerce, there were some things going on, but they face a myriad of challenges. To name a few: extremely high unemployment, lack of access to all kinds of things, transportation, healthcare, birth control, technology, lack of strong educational foundation or opportunities, very few banking facilities, no access to capital, corrupt local governments often that control any kind of resources that are there, require patronage to access those resources. So many barriers for these youth to enter into any kind of employment opportunity, and to start a small business. So if I were running a youth training and education program, let's say I run an intensive 3-month course, I've got 25 youth in my program. We work over the course of those months for all kinds of things around business planning, resume writing, how to interview, how to open a bank account, any number of things. And they all graduate, they go on, they go to do their thing. I do my follow-up, and I find out 5 out of those 25 are employed, one way or another. And I'm thrilled. This is amazing. This is a great number. That is fantastic. 5 out of 25, 20%. 20%. So if I go out there and I talk about how I had a 20% success rate, you're probably not going to whip out your checkbook and write me a check, right? Because 20% doesn't sound like much. But I have to provide some context for those numbers because it is remarkable. It is a remarkable success rate in the world in which I'm operating. So how I do that, right, it depends. There are a number of things. What kind of statistics do I compare that to? Are there national statistics? Are there competing agencies that are doing this kind of thing that I can look at their numbers? Are there subsets of populations in that? Did the girls in the program do particularly well? So maybe I just want to talk about them and talk about how they had an 80% success rate. How am I going to contextualize those numbers to speak to what success I actually did have? So I think that the clients that most of you work with, right, are in a similar kind of scenario in the set that they are facing an often complex and seemingly intractable set of challenges, right? And that's both personally and also in their communities. Mental illness, drug addiction, unstable family and housing situations, also inadequate public schooling, daycare facilities, lack of affordable housing, poor health care, terrible immigration policies, terrible gun law control policies, robust local drug markets, right? These are all things, not just one, but they're living in a world where a number of those things are pressing down on them every day. So when you're providing services in an environment like that, raw data alone is not going to do justice to talking about the success that you're having. Also, right, we have lots of multiple stays, multiple attempts at success in any one of those areas. And it's not usually, in many instances, the first round of a program, the first try in treatment, where you're going to see success. But those programs that were round one or were round two aren't necessarily showing those numbers of their outcomes that show that success, whatever that means in terms of that particular program. So the storyteller needs to provide context to that raw data, to provide an understanding of what you're talking about, and why it has meaning. So circling back sort of to Foothold and to the value of the numbers, right? Because we can all sort of, I think, generally agree that just telling a story, just telling a narrative isn't going to get you far today. You need the numbers, right? You can't just tell a story about one individual, sometimes in some context, but you still have to back what your programs and what your agency is doing with data. And so when I just was reflecting somewhat when I say, no, I've been here for 10 years, and I think about what an amazing decade that has been in terms of the data collection of all of you collectively. When I started at Foothold, we were about, not quite, 30 agencies that were using awards. Most of those agencies have been with us for a year or two, and now we have over 850 agencies using the software. And a good number of those have been with us for at least 5 years or more. So when I think about it, I think one of the terms we used in the description of this session was like this trove of data, and how much data is out there to be mined and looked at. And some of you may be more recently using awards, but it doesn't take very long at all to start to have a good set of numbers to look at and to start to be able to talk about. So the data mining potential is just awesome, and we are in a field that hasn't traditionally been particularly strong where data is concerned. It hasn't, and in some cases, I think it's almost, in some environments, almost been sort of, eschewed a little bit. That's certainly changed, and I think, EHRs are one of the ways that has pushed and promoted data as an important element of what social services does and can do and needs to use to analyze how you can do what you're doing better. So it's been a really exciting time, and that all of you now have the ability, sort of with a few clicks of the mouse, to look at all kinds of demographic data about your clients, about, in some cases over the past 10 years, who an agency has served, what kind of services they've provided, starting to compare things around zip codes, incarceration rates, kinds of services received for particular demographic groups, relapse rates, all of those kinds of things, interrelating them to each other, so that you can begin to tell a story about your agency that isn't just a narrative, but it's a narrative backed by data, contextualized by data. And I think that's, just it's not just that it's powerful, but it's required in today's environment. It's expected. And I think one of the things that motivated Yehuda and I to focus in on this particular topic is that we are aware of, and we work with it all the time, of see it all the time in the sense of our view of your databases, all of this data, but we don't always see or are aware of or hear about sort of that kind of storytelling from reporting, from the information that you pull out of awards. What are people doing with it? Are you inspired and able to look at that data and think about how to relate it to sort of all of that narrative that many of you interact with and draw out of people every day, and how can you marry those two and tell a powerful story that promotes your agency, that promotes your field, that promotes your clients on any of these levels. So everyone in this room is really well situated to take advantage of this framework, of this sort of storytelling with data, storytelling with context, to understand better what you're doing and to share that story in a variety of environments. So by way of that introduction, I want to also introduce our panelists. I'll start with Nancy. Nancy is a very accomplished businesswoman that I have had the fortune to know for a very long time, and she definitely brings a unique perspectives to this topic. So, Nancy, if I can turn it over.
Sure. Hi, everybody. So I feel a little bit like an outsider, but what I do for a living is ask people lots of questions, and then I try to turn all the answers I get into stories for my clients. So the boring way of saying what I do is I'm a qualitative market researcher. So I ask open-ended questions, right? I don't know what the answers are going to be, and I'm not even giving people a specific range of answers. I ask broad questions of lots of people, whether through focus groups, one-on-one interviews, telephone interviews. We're doing a lot more online interviews. We go into people's homes. We go to shopping with them, anything that helps. And then I take all that, I listen to it, I think about it, I analyze it, and then turn it into a compelling story which helps my clients make decisions. So they make communications decisions, marketing decisions, programmatic decisions. So lately I've been doing so much work for United Healthcare and AARP around Medicare. So if anyone has any Medicare-related questions, I seem to know, but I did this interesting study recently where I talked to a bunch of folks who were aging into Medicare, and they were really faced with a Medicare decision, and I met them first in focus groups, and then they all did online journaling for me over the course of a few months as they were getting towards having to make a Medicare decision. And once they'd made a decision, I talked to everybody on the telephone. And all that data was then, I was able to help United Healthcare understand, what do these seniors need as they're aging into Medicare? What information is helpful? What information is not helpful? How are they feeling? And then they could take that and make whatever marketing and programmatic decisions they wanted. I guess I would just say finally that I actually really love what I do. In 6th grade, my English teacher told my parents that she was no longer going to call on me because I asked too many questions. So this sort of naturally nosy way that I am has sort of turned into a way to make a living. So that's what I do.
Great, thank you. Thanks, Nancy. Also on our panel we have Jim Norcott. Joins us from Catholic Charities Brooklyn, Queens, and has done some fantastic work with awards data and storytelling. Jim, if you would introduce yourself.
Sure. Good afternoon, everyone. Just a little bit of background, much like Yehuda, I'm a social worker by training, and several years of working in mobile crisis and mental health services made the switch into software implementation internal to my agency. And I've been with Catholic Charities Brooklyn, Queens for almost 21 years now. And in that time, we've seen a great explosion in the use of technology and using data not only to tell a story, but to support business decisions that are made. As you alluded to, context is everything when you look at numbers, and my career has taken a very odd trajectory for someone who went to school for social work, ultimately resulting in going back to school to get a master's in public administration. But all of you here, I'm sure, have struggled with some of the same questions that we've struggled with over the years in terms of what do these numbers mean, what can they tell us, what can't they tell us, and can we rely on them, which is usually the largest debate in the room. We've done a number of projects with data from a lot of different sources, productivity models, client mapping, case survival rates over 30, 60, 90 days, really trying to support the business operations of the agency and the service delivery in the end in terms of developing methods of capturing data that supports outcome measures. So that's my job in a nutshell.
Thank you. Thank you, all of you. So I'm just going to frame our topic a little bit, and then we'll jump into some questions for our panelists. Sorry, thank you. So any sports fans here? I'm sure everyone's a soccer fan this week, right? So I'm not, but so I want to talk about baseball a little bit. Right. So when you think about baseball, there's lots of numbers that get thrown out there, right? After every game, they put the line, in the newspaper or online, and you can read about everyone, all their statistics, right? How many hits they had, how many at-bats, all of that, which all translate, back to numbers, right? So someone who's hitting 500, great. Like Laura said, that means a lot when you compare it to they only had 2 at-bats versus, 3,000 at-bats and they're hitting 500. That's a much different number, right? There's sort of another side to baseball statistics that or non-statistics, that you can't see on the line of, what their numbers are. It's, who's a clutch player? Like, who do you want coming up to bat when the game is on the line, right? So you think about, like, A-Rod maybe. Whatever your feelings are about A-Rod, there's lots of things about him that, people never wanted him up at bat when the game mattered because he couldn't hit, right? And that's not a number that that's not, he's a 7 on the scale of whatever. It was over time, people looked at, what happened when he came up to bat with 2 outs and the game on the line, and, people figured out that he was not a clutch player. So, I think you'll hear a little bit from Nancy, sort of that finding that unclutch or clutch player part, and a little bit from Jim about, what some of the numbers you can look at and how you want to look at those. So I'm going to start posing questions to you guys, and feel free to comment on what someone else said. We're going to hold off on questions till the end, and then so if you want to jot them down, we'll give you guys a chance to ask questions to the panelists as well. So Jim, I'm going to start with you, if that's okay.
Sure.
So can you tell us a little bit about what your motivation for wanting to look at your agency's data in order to tell your story, and was there anything that you found that was expected? Were there any surprises in the data, things that jumped out at you? Anything that you found that guided your agency in a different path than you thought you would end up?
There's always a surprise in the data. If there's not a surprise in the data, I'm not happy. I only like it if it's interesting. It's what I expected. Where's the fun in it? No, in all honesty, we're a very large agency, 160 plus programs across Brooklyn and Queens, and it's very difficult to tell a story about an agency that's that large because it's not a singular focus agency. It's not a mental health agency or a developmental disabilities agency or an older adults agency. It's all of these things. So telling that story has been particularly challenging because we have several data systems in play simply because a lot of funding sources have lots of data system requirements. So one of the biggest challenges that we've had to face is how do you get things like an unduplicated client count across the entire agency? And that's where, maybe that better? Okay. Sorry, usually, I'm Italian, so I'm usually yelling, so, sorry.
I'm Jewish.
Yeah, see, there we go, okay. I usually don't use a microphone, because I'm usually standing up doing this.
We actually talked about how we would have liked to do a standing panel, but maybe next time.
As long as I can move my hands, it's okay. My staff laugh at me all the time because I can't talk unless my hands are moving. And that's actually one of the things we use awards for, is to generate this information. And we've required folks, and unfortunately for some folks it's duplicative data entry, to enter a minimum amount of data of clients into awards so we can actually get that. And so it's still a work in progress because it takes a while to get 160 plus programs to all move in the same direction. It's kind of like steering the Titanic, I suppose. Hopefully not into the iceberg. So, in terms of, are there any surprises there? I'll be honest with you, one of the biggest surprises that we got from that is understanding exactly how the same piece of data is collected differently in 160 different programs. So you take things like race and ethnicity and the different categories that people use. Some people use census, some people use something that they used from their old job, some people just made stuff up on their own. Some programs use social security numbers and some don't. This poses some very interesting problems for us. But in the end, we need to understand our clients and we need to understand who we're serving. So that's what drove us to down that road. Is in 1993 when I started, people would ask for, find me a program manager that doesn't ask for more staff. Everybody would ask for more staff. Everybody would come up with great ideas for programs, and they'd want to do X, Y, or Z. And in the end, it all came down to, well, where's the backup? Where's your numbers that demonstrate that this is either a need or something that we as an agency could actually do? So that's really what drove it.
Thank you. So Nancy, you've been involved in market research for, I don't know, a number of years now.
20, yeah.
20 years. You led a lot of focus groups. You asked lots of questions. So can you tell us a little bit about how you get people to talk to you, and when you're looking at the things they tell you, how do you find those data elements, I guess, those things that connect together?
Okay, well, I think there are two important questions there, right? So first, how do you get people to talk to you? Which is, I bet a lot of you have similar social working backgrounds here, and I do too, but in an informal way. But I think I sometimes make a joke to break the ice, and then you just have to listen to people and look at people and connect with people and hear them and be honest that you actually do want to hear what they have to say and be present. So that's something that you all, I assume, know how to do because you're all in this field. It's interesting though, I have to say, it wasn't, now it's sort of intuitive how to take all these disparate stories and turn them into one narrative. I don't even think about it anymore. But I remember in college, where I met Laura, I was interviewing all these women for this women's health project, and I had these, so interesting, all their stories, and then I didn't know how to turn that into a report. I didn't know, all of a sudden I had these 10 interesting stories, and I ended up sort of faking it and just writing about one. And that was not good. I think I got a minus on so whatever. But I think the key is to always start by thinking about what your funder, in my language is client, but I think for you guys it's whoever your audience is. What do they care about? What are their objectives? What matters to them? And I never start a study unless I'm 100% clear I know exactly what my client is looking to learn. And that's sort of your beacon, right? You just keep that in the front of your face or the front of your mind at all times. That's what matters. That's how you're going to analyze the data. That's important, number one. So everything is filtered through your client's objectives, what they care about, and what matters to them. The second thing is whenever there's something emotionally compelling, that's the stuff that's going to tell a good story, right? Whenever you have the people that you're interviewing contradict themselves, or whenever they're talking about something that really matters, or people are disagreeing with each other, or just anything that's intense, frankly, that's just the stuff that I care about the most. And then the story, just whenever you see consistency, whenever you hear something repeated a lot, you know that that's important and you gotta mention it a lot. But then the key really is how do you take those consistencies and turn it into a story that your client's gonna listen to. And so some of that is how you actually present data when you actually, if you get a chance to stand up in front of somebody, that you actually try to tell an entertaining story, move your arms around or whatever you need to do to tell the story. A lot of times we try to bring the voice of our consumer or our audience alive. And I mean, I'm sure you guys are trying to do this all the time, whether it's, we used to just like in old fashioned ways use quotes, like this, the person actually said this. And so it feels more like the voice of the consumer. More and more now we're really trying to embed video into our presentations so that the clients can actually see the story come to life. But really my job is to bring the client, bring the respondent, whoever it is we've interviewed, into this room, into the room where you, the client, is sitting so that you actually experience what the respondent had experienced. I hope that answered your question.
I was just going to tag onto that, or sort of maybe when you're talking about the client, or sort of using these different words that we use a little bit differently, but I think that right when I think about the agencies that I work with, one of the voices actually that I think often is not considered, oddly, when agencies are thinking about their data and thinking about what they want to ask, what they want to report on, is themselves. It's not, of course, your funders are your lifeblood, but what do you, the agency, want to know about yourself? And are you asking those questions? Are you gathering that data? Maybe there's not a funder today that's asking that exact question, but maybe there will be in the future, or maybe you just need to know and want to know so that you can make smart programmatic decisions, make smart fiscal decisions. So in that sort of data gathering, I think the client being your funders and yourself as one of those people informed by the information that you're trying to gather there. So, yeah.
So I'm gonna keep the microphone, Laura, here. And obviously we work at Foothold. We work with awards all the time, and we have lots of theories about the advantages towards using an electronic health record. We could probably talk about that forever. But one of the very nice things is that data is always accessible and it's in one place and it's it's really there to be used. Can you and becomes sort of pretty easy to look at like client trends over time and things like that. So client being your agency client's a little bit different.
Sorry, yeah.
No, that's okay. So is there something that you found that's a particular use of reports that tells a quick story about different agencies or that you've worked with or heard about?
Yeah, I mean, I would, to kind of answer that a little bit generally, I would definitely say that like basic demographics and basic service provision data is a quick snapshot of who an agency is, what are you doing, who are you serving, and what are you doing to serve them. That is sort of basic snapshot. Anybody who's used awards, any agency that's used awards for a month can start to look at those numbers and have something to talk about or that reflects what they're doing. And then, you can just kind of roll from there, right, and start to do certain kinds of comparative analysis around those things and other things, whether that's zip code or incarceration rates or trends over time. Again, sort of depending on how far your data goes back, those things start to present a more complex picture of what's happening. And I think it's success, but you also, like to Jim's answer sort of around finding surprises in the data, right? There are challenges, there are failures, there are programs that don't work, there are kinds of service provisions that, in fact, the numbers may really tell you that there isn't success there. And that's not necessarily something that you're going to use to tell your story externally, but it's information for yourself, potentially for the field in which you work, that provides numbers that are equally important in many ways. Again, maybe not so much with fundraising, but in the short term, although probably in the long term, that inform, again, the information that you have. And that's one of the things, right, that there's it's almost like things are revealed by the data. And again, those surprises of we think we're doing X, we think we're providing a lot of this service, we think most of our clients are whoever, this sort of general picture, and then the numbers may show that actually maybe you're not quite right about that. And sort of those reveals are made true by the data in a way. I mean, there is a sense that in some ways the numbers do speak for themselves. But definitely the demographics and the services is a quick and dirty. I do want to add, though, just as you was referencing advantages of an EHR, and so my clients know that how passionately I really do feel about reporting and the value of reporting. And this is not an executive conversation. Reporting in awards is for everybody, whether you're a caseworker with 10 clients and you want to look at how many notes you wrote over the last 3 years, or whether you're an executive overseeing 180 programs or whatever it is and want to see what's going on over time and all in between, that the EHR provides that ability to look at that and have that information from whatever level you are, to again sort of foster movement, change, smart decision-making, policy planning, fundraising, any one of those things that any one of you might be involved in. And I feel that is really sort of a motivational and important element of having an EHR. It's something that's really, that reporting on every level as relevant is something that shouldn't be overlooked. It's not just about data entry, that there's a huge win in reporting for everyone, which I think, again, just to highlight that as an advantage of having an EHR.
Yeah, absolutely. I think sort of the next question is for Jim, and we'll kind of talk a little bit about some of the uses for EHRs and reporting over time. You mentioned you have over 160 programs, and how basic data collection can be challenging, which makes obviously the reporting a bit of a challenge because one program defines something one way. So what were, I guess, some of your early approaches to how you were going to get some information out of your data, and how did that sort of evolve over time? Where did you end up with, or where are you today?
So in the beginning, Excel was my best friend, and to some extent it still is. We'd have to develop crosswalks between data sets, and I think one of the most important pieces that I think gets lost if you're not dealing with data on a regular basis is understanding how the data is collected in the business process. You can't put the context around the data if you don't know how it was collected and what purpose it was collected for. And that becomes a problem when if you're pulling data from systems that you're not terribly familiar with. So if I needed to pull something from ACS's data system for our prevention programs, I really needed to rely a lot on the program staff to be able to interpret for me what that really meant, so that way I could then do a crosswalk to data sets from other parts of the agency. Problem with that is it's very time consuming, and at that point in time it was basically me, myself, and I doing all this work, and I now have a department, and I'm telling my staff, yeah, we don't want to use Excel anymore. We really don't. We want to get away from it, and to as much as possible, we want to stop creating data collection tools. That's in all honesty, a lot of what the Excel work was to collect data, because again, with 160 programs, if you want to get something from everybody, and you're not terribly well staffed for this, you need to get the data in a consistent way, so we create Excel spreadsheets and ask people to fill it out. That only takes you so far, and yes, you can do it, but it's slow and painful. And then you always get somebody who decides that, or you forget to lock your spreadsheet and somebody messes up a formula, or puts text in a field that's expecting a number. Or my favorite, and this is the real reason why I stopped really stopping with Excel data collection tools is I sent you the spreadsheet in an email, you open it as the attachment, and you send it back to me with the exact same name, so I know exactly which program you're from. So thank you very much, and it's a head. So what we've done over time, and the only approach that I think works, at least for us, is my staff and I, we go in and we tinker with their work processes. We talk to them about how they collect data as part of their daily work. We look at their forms. We just redid all the documentation for our prevention programs. And we looked and we saw 25 pages of narrative. Even better yet, handwritten narrative. Love handwriting. And we worked with them, and they were really very receptive to the idea of taking some of the data out of narrative and putting it into checklists and multiple choice options and things of that nature. It makes their jobs easier. It makes it faster for them to do their jobs. You can't do that entirely because then you lose a certain qualitative flavor. So you have to merge the two. And in doing that, we've now set them up in a way that when we want to get reports, it's going to be a lot easier. One, we help develop their paperwork, so we know now how they're capturing data. Two, we made sure that we nudged them in the direction of, this really could be a checklist. One of the things they had to look at were various safety aspects in houses. I said, well, there are certain rooms in a house. Why don't we just list all the different rooms that would be in a house? And then, were there anything that you noted, yes or no? Let's just go there, and then a space for you to write if there was a positive finding. And they were very receptive to that because they saw that as being beneficial to making their jobs easier and faster. It makes the supervisory review process faster. It makes ultimate translation into an EHR a heck of a lot easier. And then the reporting at the end. So that's really been the evolution of getting away. You start with the tools that you have, and the tools that we had at the beginning, Excel, and it's a wonderful tool, but it's not a.
Thank you. So, I want to sort of piggyback on this reporting across agency and consistency, and keep going with that topic a little bit. So, Laura, we talk at Foothold often about how that's difficult and challenging, and anyone in the field knows that that's a challenge. Have you sort of seen any creative ways of making things consistent across different types of programs, so that agencies can use their reporting in a more meaningful way?
So, yes. Yes. However, while we do celebrate agencies finding creative solutions for any kind of problem that they're having with awards, I actually would want to take that question sort of back a step and say, we'd rather you not be finding a creative solution because we'd rather you have things configured and designed from the get-go in the way that you need. And creativity is needed because there are, in any system, right, there are going to be some limitations where you just can't quite get the information that you want. You can't quite run the report that you want in awards. You want to compare these elements, but awards isn't allowing you to do that. So there is a place for that. But I don't know if any of you sat in on the implementation session in this room just before lunch, but it was spoken about very eloquently by several of our clients in that session about, in retrospect with their implementation, one of the things would be this kind of analysis about data, forms, cross programs. What does the whole agency want to know? What does this type of program need or want to know? And then maybe, there are individual one-offs on some particular program or program type, but as much consistency as you can have. And implementation doesn't just have to happen right when you start up with awards. It can happen tomorrow. And a reevaluation of I think we really talk about it often as sort of an ownership of your database, and making sure that it is working for you. So you're asking the right questions, you have the right fields that is required, you have something that is not a narrative text box. You can't really report off of a narrative text box. You can tell a narrative story, but you can't run some numbers. You need to change that into a drop down or a checklist or, you know, whatever those sort of field choices are that have a discrete set of responses that must be answered. And, you know, that's a process, and it's an interactive process, and it's not just QA sitting or someone like Jim sitting and making those decisions. It's going out there and interacting with program staff and figuring out, you know, the answers to those questions. And the thing that you know, we try to discourage as much as possible is sort of often we see, particularly with new agencies, kind of this plunking down of like, here are our forms, and we're going to put them in awards. And there just needs to be critical thinking around that. Have you used this form for 20 years? Is it asking, are you spending time asking your clients the right questions? Or are you kind of wasting your own time and their time if you're not getting anything from what's on that form? And then again, when you're moving certainly from paper to an electronic system, are you asking the questions in the right way so that you're going to get actual data elements that you can look at and compare with each other? So there is room for creativity sort of at the very final hour or the end game, but rather we would see well-constructed, well-thought-out, you know, owned databases that really ask the right questions and get to the heart of what it is that you want to track. And that should certainly also be reevaluated periodically, right? You don't always make the right decisions the first time around. Things change, you have different funders, you have funders that are interested in different things than they were 2 years ago, so you've got to start asking different questions and tracking different information. It is absolutely not static. As sort of the environment in which you all work is constantly changing. So, you know, and we do have fantastic tools and awards, the report builders and export builders that can get you quite far and can be used creatively. And occasionally we are left with taking things out of awards and doing work in Access or Excel or whatever as a last resort. And I don't mean that as, sometimes that works, sometimes that's what you need to do, and that can be fine, you know. However, the ideal always would be, right, as much as it can be a click and you can be in your system, that's great. So as much as you can configure your database to not get to a point of creativity is what we would encourage all of you, I think. Yeah,
absolutely. So, you know, once you come up with your report and you have your bit of data, there's, you know, Jim said you would be shocked if there wasn't a surprise in there, or surprised if there wasn't a surprise in there. So I want to ask Nancy, was there ever a time where you were brought into this job and you were looking for your narrative and you came up with something that was unexpected or unanticipated by the client? And, you know, how did you present that to them? And, you know, you talked a little bit earlier about the presentation matters a lot, whether you're getting up in front of the room. So what were you able to do to sort of, you know, deal with what you found or what you had?
It's interesting. I mean, I feel like, as in contrast to what you say, I always think that when you're doing qualitative research, typically you come back and what you say is not a surprise. Because like it has to make intuitive sense. You know, it's maybe a little bit different than it is with numbers, but when you go out and, you know, I don't know, when talking to people, I mean, I've done every topic known to mankind, like whether it's like condoms to lingerie, to newspapers. I mean, whatever you're talking to people about, you know, insurance, I'm trying to think of other categories. Typically, they have some sense of their customer or some sense of how their target customer feels about stuff. And if it's counterintuitive, the story that you bring back, it's something might not be right. You know what I mean? So it may not be that people, your clients, my clients may not be able to anticipate what the answer is going to be or what people are going to say. But when I come back and present it, if it's really surprising, oftentimes that it would be shocking because it needs to make sense in the end. And I hope that makes sense what I just said. That said, there are times where you're telling something, you're reporting back data that doesn't make people happy. Even if they kind of knew it, like maybe if it's as straightforward as like getting response to different creative that an ad agency is. And the folks who made the creative you're presenting to them, and they were really into it, but the folks that you asked about it, they hated it. You know, like, how do you deal with that? Or, and there are just ways in which, again, you sort of have to know your audience and tread lightly. And if you're talking with the creative in the room, you sort of say, these are the things that really worked. These were the challenges. But if the creative are not in the room, sometimes you present that same data slightly differently. And you talk about this kind of stuff really doesn't work. And then, you know, you can, when you're presenting data to the CEO of a firm, you know, you make it really short, you get right to the point, and you focus on the high level. And then I'll present that same data to a marketing team and say, and this page of the brochure worked this way. You know, you can get really to the nitty gritty. So I think it all just comes back to that same thing I said earlier, which is really understanding who you're presenting to. And while it's not like you're lying by telling one story one way and another story a different way, it's just knowing your audience and understanding how best to present things. I hope that helps.
So I want to come back to that in a couple of minutes, you know, to talk about how you deliver information to different types of people, because I think that's something very relevant to everyone. Before we get there, I want to go back to something Jim mentioned earlier. You talked about, you know, getting into the programs and helping them improve their processes and collect data in a meaningful way and, you know, ask the right questions at the right time. Can you tell us a little bit about what you did? Like, how did you go about, you know, how did you start that project of, you know, this is what you do today, this is where we want you to end up. What information did you collect, and how did you analyze that?
It usually, well, for us it actually started as a result of switching into Medicaid over to managed care in our behavioral health system, because when I started with the agency, we were organized geographically, so our mental health clinics actually had 4 different directors to whom they reported to. So they had 4 different charts. And actually, there were probably 5 variations of the charts. And so what happened, what forced the issue was managed care contracts. They want a copy of the chart. They want to see what data you're collecting. So it forced us to look at the issue. But generally, at this point in time, what winds up happening is there's a situation of one kind or another, and it usually revolves around programs finally somebody says, hold up, I want to find out something about my program. And when they do that, that's my intro. That gets me in the door. Because at that point, I ask the next question, which is, well, why? Why is my favorite question. I sound like a 5-year-old kid. Why? And because what happens is we'll usually start off with, there are 5 basic processes in any social service agency, and starting with an intake, assessment, treatment planning, service delivery, discharge. And I want to go through all 5 of them with each of my programs. And I constantly just ask why. Why do you do this? Why do you fill out this piece of paper? Okay. When we did it with the mental health clinics, in all honesty, people were filling out paperwork that hadn't been required in eons. And I mean, that's just the nature of it. It's what happens. So doing this process, you know, people, as we move forward, and I think as we all are dealing with funding cuts and increased workloads, people are looking for more efficiencies in their work. So that's another avenue to walk in the door and say, hi, we can help you with that. And at the same time, in doing that, set everything up in a way that we can move it into electronic records somewhere down the line. I tend to like to model on paper first. That's just my general preference.
I think it's interesting because in your process of collecting data, you sort of went with the narrative of, you know, why are you doing this, and, you know, pulled out
Yeah, it's very much.
points.
These are 2 sides of the same coin. And the skill sets fit into both. I mean, I think Nancy, you're trying to pull a thread through a whole bunch of narrative, and I'm trying to take a whole bunch of data and push it into a narrative. So it's, you know, the same coin.
I mean, frankly, some of the best research is when you do qualitative and quantitative research. So you sometimes do qualitative data first, research to know what the possible, like, to figure out what's gonna be in that drop-down menu, right? And then sometimes you could do qualitative research afterwards to give color to why 25% of people said this and blah, 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 blah. So I think to Laura's point, I mean, they work really well together, so.
I also just think, just to piggyback on Jim's there too, with it's such a win on both the data collection and the reporting to be thoughtful about the reporting. Right, there's data, there's sort of process flow and usability that has to link into how you're filling out these forms or when the data elements show up, what's required, that kind of thing. But it's a win to streamline for your reporting and get rid of the extra if it's not serving a purpose. So those two things cannot be tied very closely together, for sure.
So I want to go back to your point about, delivering this message and who you're delivering it to. So if you can use data to tell any sort of story, right? You can tweak numbers to say something, and there are ways to do that. Obviously not recommended, but it's sort of possible.
But people write surveys. I mean, it's important to be critical of of the data that you consume in terms of how people, political polling, whatever. People write those questions in a very particular way to provide certain answers. Yeah.
And then once you have the answers, you want to provide that back to people in a very particular way to get a response, right? So if you're in an elevator with someone who has a lot of money, you might want to hit on certain points, or if you're applying for a grant, in a written format, you would, frame it a little bit differently. So can you talk about how you frame those different things, and what are things you want to always make sure that you touch upon to really get, this story to jump out at?
Well, I think it's interesting. I mean, so I've been doing a lot of work for this large education company lately. Been doing all this interviewing of dreamers, young, undocumented people who were brought to this country when they were young, and I had to present that data both to the CEO and the president and the head of marketing, as well as people who were really implementing this stuff on the ground. And it was very emotional stuff. I mean, these are people who, some of the people there were frankly anti-immigration, both at the high level and at the more junior level. I needed to convey the emotional experience of what it was like for these dreamers and the challenges they faced to both audiences. But in a very, with one audience, I knew you guys know when you sit in an audience, you want it to get right to the point and you want it to be brought to life. So I needed to be able to tell the sort of stories that were going to really help them emotionally connect with the data, right? And then I needed to sort of lengthen that and give lots of, I'm sort of repeating myself, but lengthen it and give lots of detail for the folks who are on the ground. But for both audiences, I really had to bring those people's stories to life in a way that sort of gave, even if they were politically not aligned with the project, to at least have some compassion with the experience of the people who the company overall was trying to serve, if that makes sense. So it's very interesting when you think about data, and you could get up there and say this, blah, 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 or you can really help people understand what the data actually means and why it's significant and how and what kind of people it's affecting and how it's actually affecting them. Actually give some life to that data. So.
Thank you. So I could probably ask a million more questions because this is something I'm very interested in, but sort of short on time, so I wanted to open it up and see if there were any questions.
Yeah, I wanted to ask Nancy, do you know of any social service agencies or funders that have actually used qualitative research to sort of investigate from the client populations what from the client's perspective they thought worked, didn't work in terms of their treatment or whatever? I mean, is it just about, as you said a minute ago, it's both quantitative and qualitative research that has to be done?
It's very interesting. So much of research is done with employees, right? Like big companies, small companies are always trying to sort of keep the pulse of their employees, which is different than sort of the clients that you serve. I've done a lot of work for the New York City Department of Health, and this is a little bit different, but it's like their clients sometimes are just us, right? The people who live in New York City and trying to keep us all healthy. So I've done focus groups with young moms to try to understand the influences of how they put their baby to sleep. And I did focus groups with both young moms and actually and separately with young moms' moms, so the grandparents of young babies, to understand how they made decisions about how the babies were going to sleep and the role of the moms, so that they could then make decisions about developing campaigns for SIDS, the sudden infant death syndrome. That was a few years ago. So that's a little bit different. We also have done similar projects around like breastfeeding and obesity up in Harlem, and so it's not exactly like understanding, having done a project and then going in and assessing, but people do that all the time. It's called evaluation, you know. So and people use quantitative and qualitative. Typically, funders want to see quantitative measures, right, of the impact of things. But if you can bring the qualitative data in, I would imagine it tells a much more compelling story. You know, I don't know if I answered your question at all.
Well, I guess it was just to carry on one more second. What do you think would be the difficulties or the barriers or something like that in doing a focus group or whatever kind of thing with client populations? And this is about influencing outcomes. So if you took 20 clients who went through your program successfully versus 20 who failed, okay, the information that you'd get for the 20 who were successful should be quite useful in terms of the agency as a feedback loop designing a treatment plan. I guess that's what you meant by evaluation. I just don't know how often that's done or how well that's done.
Yeah. I mean, I think that there are tons of funders now who require, this is evaluation as a part of the re-upping of the money, right? That you have to somehow prove that that their money is actually having some impact. But to Laura's point, it has to be contextualized. Once I did a study for United Healthcare with women who had all been diagnosed as having some sort of health, heart, and something had been wrong with their heart at some point, had been in their chart. But there were all these, for some reason, they were all these women they knew were not going to get their, they weren't getting care that they needed. So I interviewed a bunch of women with heart problems and trying to tease out the factors that were leading, either encouraging them or discouraging them from getting the care, going to visit the cardiologist and getting the treatment they needed. And so I was able to tease out the factors that seemed to be encouraging people, but what the barriers were in terms of denial, fear, transportation, resources, other problems being much bigger. So from, I guess it's somewhat parallel to what you're talking about.
This was totally blind, or you had demographics on each of those people.
Well, it
wasn't like, all the Asian women were in denial and all the African American
When
women.
I talked to 30 people, so I would probably be reluctant to make those kind of generalizations. I mean, with qualitative, you sort of can say, look, I see a pattern enough. I tend to not, the demographic stuff I'm more wary of doing that way, but I see a pattern enough with the women who had more significant health problems. They were probably less likely to consider this a primary, issue that they had to tend to. So that I would say, but with the demographic stuff, I'm more reluctant to with qualitative data.
Any other questions? So I think we're just about out of time. So I want to sort of wrap up a little bit. Just for me, I want to take it back to baseball a little bit. Right, so if you think of your agency as the team, right, each team has their wins and losses, things that work, things that don't. The players might be your clients, and you want to look for their stories, both their individual stories and then their stories across the team that tell you something meaningful, so that you can start to share that story and look at the trends among your clients. I think I want to thank everyone for coming. I want to thank the panelists for joining today. I do want to point out one thing. We have our ice cream social. There's some drinks, ice cream at 4:30. 4:10. So please stick around, join for the day. It's a chance to really connect with all the other agencies that are here, right? The content you can get anytime, but those connections you can't. Hear other people's narratives and their stories. And I think that's it.
Thanks, everyone.
Thank you.
Yeah.